All new tonight at 6 o'clock, a Georgia woman has been identified as one of the first known deaths related to a lack of abortion care access.
Yeah, that's according to her family and state documentation obtained by nonprofit newsroom ProPublica. 11 Live investigator Savannah Levins joining us in studio after reaching out to the family herself here. Savannah, what did you learn?
Well, so I know Amber Thurman died waiting 18 hours for a D&C. That's a surgical procedure sometimes used in abortions. The report finding her death likely could have been prevented.
It was jarring, shocking, and disheartening that my Georgia doctors could not provide me with the standard of care.
Georgia women and medical providers testified before Senator Jon Ossoff's Human Rights Subcommittee Monday in opposition to Georgia's law banning abortions after a fetal heartbeat is detected. Medical experts say that's typically around 6 weeks. At the same time as that testimony unfolded, nonprofit newsroom ProPublica released a report on internal documents it obtained from the Georgia committee tasked with reviewing pregnancy-related deaths. The report indicated the committee, run by the State Department of Health, determined the death of 28-year-old Amber Thurman was likely preventable if she'd had access to abortion care in her home state of Georgia. The report states Amber was going on 8 weeks pregnant at the time. Her family sharing with 11 Alive that she drove to North Carolina to obtain FDA-approved medication to terminate the pregnancy, saying by the time she arrived back to Georgia, she'd started bleeding heavily. According to medical records cited by ProPublica, Amber was rushed to a hospital in Metro Atlanta, where doctors noted twice that a D&C procedure should be considered to remove the infection. But the procedure, often used for abortions, wasn't done, not even when Amber became septic.
She was clearly septic, and she was hemorrhaging. She should have had a D&C right then and there.
Dr. Lillian Shapiro with Ideal Gynecology in Atlanta wasn't a part of Amber's care team, but says the state's so-called heartbeat law has caused confusion for medical providers who might not know when they're legally able to intervene.
My heart goes out to them because they knew the answer. They knew the answer, but they have had fear put into them by the court system, by these new laws that they don't understand.
Vice President Kamala Harris issuing a statement Tuesday, writing in part, "This is exactly what we feared when Roe was struck down, and now women are dying." Advocates of Georgia's abortion law say it has clear exceptions for medical emergencies and includes expanded support for expectant mothers, from broadening Medicaid coverage to expanding maternal health resources like in-home medical visits in rural and underserved areas of the state. And Governor Brian Kemp's office has just released a statement to 11 Alive Investigates saying, in part, "We cannot confirm or comment on the circumstances surrounding Ms. Thurman's tragic passing. Every life is precious, including that of Amber Nicole Thurman, which is why we support life at all stages in Georgia." Governor Kemp's office also calling this an attempt to spread dangerous misinformation, but did not specify what that misinformation might be, saying that they can't comment on Amber's circumstances since it would violate federal patient privacy laws.
All right. Thanks a lot, Savannah.